Hello, I'm Dr. Bittiker. I'm a chiropractic physician. I'm a board-certified chiropractic neurologist, and I've been practicing for over 34 years. I've treated well over 20,000 patients in that period of time. And one of the more common conditions that we see here in the clinic are two things: fibromyalgia and chronic fatigue. We hear a lot about these particular diagnoses these days. It used to be years ago when people had this particular type of problem, they were told that they were it was all in their head, or they were faking it. Or 150 years ago, they gave it another name. They called it a malaise or something like that. But they really do exist, and there are criteria for them. Now, you may wonder why I picked the two conditions, fibromyalgia and chronic fatigue. Well, let's get into what they are. Fibromyalgia is basically the patient will come into the office saying, "I hurt all over." Knee pain, hip pain, back pain, neck pain, headaches, that sort of thing. And there is a certain criteria, the number of trigger points of pain refers down to a particular extremity, but I can tell you that it's pretty obvious diagnosis. They basically say the same thing. They hurt all over, everything hurts all the time, weather makes it worse, the whole thing. Then you have chronic fatigue. Chronic fatigue people are people who have a sudden onset of fatigue. We all get tired at certain times in our life, but this is different. This is real major fatigue. The big difference is you go to bed at night, you wake up the next day, you're just as tired, if not more tired than you were when you went to bed the previous night, and it just gets worse until finally some people are at the point where they can't get out of bed. Now, why do I put these two together? Well, the reason is this. I almost never find a patient who doesn't have components of either one of these conditions. In other words, you don't find somebody with pain all over the body like a fibromyalgia patient who says, "But doc, I may hurt all over, but wow, I got a lot of energy. I can just do anything I want to do." And you never find somebody with chronic fatigue who just says, I can barely get out of bed, but I have no pain. No, they almost always go together. Because in my opinion, they're parts of the same condition, syndrome, problem, disease, whatever you want to call it. They almost always go together. In fact, I've never seen them when they were separate. So that's why they're together. And the truth of the matter is they're treated about the same because they have the same causation. Now, what you'll see in combination with these conditions, besides the chronic fatigue and the pain all over the body, is some other things. You'll see light sensitivity. Bright lights bother these people. Insomnia. They don't sleep well. You don't ever run into a chronic fatigue patient that sleeps well. The fibromyalgia patients are in so much pain they can't sleep, or if they use a pain medication, they're drugged. They're not really sleeping. Then you've got the irregular heartbeat. This is quite common. Some people have a diagnosis of mitral valve prolapse, but almost all of them are experiencing heart palpitations at some time, and it can be quite scary for some people. Increased perspiration, a very common thing. You'll be sitting in a room with the air conditioning, it may be set at 62 degrees, and you're still sweating. You see this in a lot of people who have inappropriate temperature regulation. Pain. Well, we went into that with the fibromyalgia, but pain, a peculiar sort of pain. Maybe no swelling in the joint. The joint's not hot like you would see with an arthritic condition, but nevertheless it's just sore all the time. Brain shrinkage, interesting thing. People with chronic pain on MRI scans have been shown to have shrunken brains. The chronic feedback from the spinal cord and the nociceptors, the pain receptors up to the brain and the stem and into the brain actually cause an overfiring of the brain cells and cause damage to them. That's why we've actually noticed in people that have chronic fatigue and fibromyalgia that their IQ actually decreases over a period of time. And we're not picking on these people. There's a logical reason for this. Pain does that to you. It dulls your brain. It damages your brain. IBS, irritable bowel syndrome. All the time I ask people if they have IBS, and I usually get a no answer, and then I say, "Can you eat anything you want?" And they'll say, "Well, no. If I eat this, I get diarrhea or bloating." Well, you've got IBS. It's a very common condition. And the actual firing mechanism of the brain may contribute to the fact that you have extra motility in the intestinal tract, which I'll get more to that later. Depression and anxiety. Well, wouldn't you be depressed and anxious if you had a life of constant pain and you were just so tired you couldn't get out of bed? But actually, in many instances, this may precede the chronic fatigue and the fibromyalgia, because the same condition that's causing this is also causing the depression, which can be a neurotransmitter problem. This is a nervous system problem. Chronic fatigue, fibromyalgia are nervous system problems. I'll get to that in a moment. Weight gain. Yeah. Well, some people say, you're hurt, you don't have anything to do but eat. Well, that's one reason. But depression and anxiety are associated with weight gain too. But there's also some problems with the regulation of the hormones in the body. In particular, the nervous system being out of balance can cause the pancreas and the insulin numbers to begin to go up or down, to gyrate back and forth, and you can end up with a lot of problems that way. So it's all related. But the key to this is it's the nervous system. Now, I'm going to show you what I mean by that. This is a crude diagram because I drew it, but it's pretty accurate. This basically represents the right side of the body, left side of the body. Now, up here you'll see a side view picture of the body with the brain up here, the cerebellum, the cerebral peduncles, the pons, the medulla oblongata, all these things, the side view picture. And you can see that the nerves come from the spinal cord down, and the nerves come out and they control the organs of the body like the heart, lungs, stomach, liver, kidney. All these things are controlled by nerves that connect back up to the brain. Okay, now this is from the front. This will be the right side, this will be the left side. The corpus callosum is the kind of the lines that connect the left and the right sides of the brain. Okay, so you know how it's, you've been told probably in your high school class that the left side of the brain controls the right side of the body and the right side of the brain controls the left side of the body. Well, that's true most of the time, but there's more to it than that. You also have things down here below at the bottom of the brain. You can see the side view picture of it up here. It's called the cerebellum. The cerebellum controls, among other things, coordination and the smoothness of the movement and all that. And it basically lets the other side of the body know what one side of the body is doing while it's doing it, so you have balance. So if you pick up something like this, then your body will lean away a little bit because the cerebellum did the thing that it's supposed to do with the brain. And that's how it works. Now, the cerebellum, the way the nervous system fires is that the left brain would fire to the right cerebellum, and then it fires down to the body to tell it what to do. So, for instance, if you want to pick up a rock and with your right hand, the signal will come from the left part of the brain through the spinal cord, cross over here through the pons, and over here to the cerebellum, and then it'll go out to your arm and you'll pick up the rock and do whatever you're going to do with it. And the signal will go back up the same way as you do the sensory part of the signal. So that's how the body works. Now, what happens though is that if the brain has a certain firing rate, when we do an EEG, an electroencephalograph, we can see that there's a certain degree or frequency that the brain fires. It literally is, it has a certain frequency, and there's different types of brain waves. Well, what happens if one side slows down and the other side is still functioning at upper level? That's when you start to have problems. You see, you have the bottom part of the brain here is called the mesencephalon. Then you have the pons, and then you have the medulla oblongata. There are different parts that do different things. Now, the mesencephalon is what fires down your body to run your heart and your lungs and your stomach and all these things. Now, if